Okay, Madhurim. Dr. Madhurim,
Yes.
madam, are you
Yes,
here?
sir.
Very good.
Yes, sir.
Thank you. Let's start.
Okay, so I'm sharing the
Please complete within 15 minutes.
Sure, sir.
Okay. By about 12th minute, I will remind you. Please introduce yourself.
Okay, sir. So first I'm sharing my PPT.
Carry on.
Okay, sir. Hello everyone. Myself Madhurima Sharma and I am a PhD scholar at IIPS Mumbai. Thank you for giving me the opportunity to present my research work here. And so today I'll be presenting and talk about once again. Yeah. Today I will be talk on the topic basically the wealth disparities and cognitive impairment among the elderly in India and analyzing the contributing factors. So let's go to the background. As you can see here, as people age and India's population is aging and overall the world is also aging. Age-related health issues are significantly increasing with the aging process. So in India, the geriatric population is expected to increase around 19% of the India's total population by the year of 2050. So as people age, it is natural for some cognitive abilities to gradually decline. This is called cognitive aging. It is a normal part of the aging process. But on the other hand, the cognitive impairment goes beyond the normal aging. It involves significant decline in cognitive abilities, like which affecting memories, decision-making power, and other performing the daily activities. So cognitive impairment is one of the major severe public health concerns of the 21st century among all the known psychiatric disorders. As worldwide, around 55 million people have dementia, with over 60% who are living in the lower and middle income countries. So, here in the study, we have measured the cognitive impairment through 5 broad domains. These are, first one is memory, second one is orientation, arithmetic functioning, executive function, and object naming. And after combining all the 5 domains, we got a composite score ranges from 0 to 43. And the higher the score, which indicating the better cognitive functioning among all riders. And we have divided it in 2 parts. First one is those who have got the score lesser than 10 percentile. They have been classified as cognitive impaired. And second one, those who are scored more than 10 percentile, they have been classified as non-cognitive impaired. So let's come to the objective of the study. First one is to assess the prevalence and determinants of the cognitive impairment among elderly ages 60 and above in India. And second one is to measure the socio-economic inequalities in cognitive impairment among elderly and determine the contributing factors to the inequalities. Next one is, here I have used for the study the LASI data, longitudinal aging and study in India, wave 1 data. And the present study is based on the eligible respondents aged 60 years and above, which is the sample size, the main sample size is 31,464 all riders. So these are the outcome variable of these are the study variables of my study. First one is the outcome variable. The outcome variable, we have taken the binary outcome variable, which is cognitive impairment. 0 as not cognitive impaired. Second one as a having cognitive impairment. An explanatory variable, the main explanatory variable was economic status, which has been measured through MPC, monthly per capita expenditure, which is computed as the summary measure of consumption of the household. And this has been divided into quantiles. 5 quantile 1, which is indicating the poorest, and quantile 5, which indicates the richest. And other exposure variables has been classified in demographic, socio-economic, social support, and health factors. So let's come to the statistical analysis. For objective 1, we have done bivariate analysis to measure the prevalence rate of all the socio-economic, demographic, and health factors, and chi-square test has been used to check the intergroup differences in the prevalence of cognitive impairment among elderly. And binary logistic regression has been used to estimate the effects of demographic factors and different predictors on the cognitive impairment among older adults. So in the equation, you can see in the above regression equation, x 1, 2, and 3 are the predictors, and a is the intercept, and b beta 1, 2, and 3, and up to beta n are the regression coefficients. So for objective 2, Now we have computed the concentration index and concentration curve have been measured. First one here, the age in the equation you can see here, the age is the health outcome, and mean is, mu is the mean of the diagram of the equation. And second one is the work steps decomposition analysis has been performed to assess the contribution of the each factor to the inequality. And so let's go to the results. In here in this table you can see that more than half of the participants are female in this survey, and around 61% of them are currently married, currently in a union, and about 70% of the participants are residing rural areas. And among them, about 30% of the older adults have reported they have depression, and around 76% have reported that they don't have any difficulty in ADL means the activities in daily living, and about 48% among them have reported that they are facing difficulties in doing their instrumental activities in daily living like cooking, dressing, and different instrumental activities. So this is the prevalence of cognitive impairment by demographic, socioeconomic, and health determinants. And you can see, compared to male, female have much more higher prevalence rate of cognitive impairment, and those who are currently married, they have lesser prevalence compared to those who are not in a union. And in terms of caste, you can see the ST population is much more at risk in terms of cognitive impairment, and in case of socioeconomic determinants, you can see those who entirely those who have no education, they have much more prevalence rate of cognitive impairment compared to others. In this diagram, we can see we have shown the prevalence of cognitive impairment among elderly persons across the states of India. You can see that here that the eastern region and northeastern part of the states have reported the higher prevalence of cognitive impairment among older adults. And in case of male, in the diagram you can see here, in the northern part and the western part, it is showing the higher prevalence of cognitive impairment. But in case of female, it is showing in case of Andhra Pradesh and Bihar and Jharkhand area, it is showing the higher percentage of cognitive impairment among elderly women. So the biological regression results are showing here that the females are much more vulnerable in terms of cognitive impairment than male, and as discussed here, and those who reported their health as a poor, self-rated health, they have been rated their health as poor, they are much more vulnerable to the cognitive impairment. And in case of social groups, as you can see, compared to those others, the scheduled caste and scheduled tribe population are much more at risk of this cognitive decline. So you can see in this here also, those who are receiving financial support, they are at lesser risk in terms of cognitive impairment. And in education level also we have already shown in the previous diagram. So next, here you can see the concentration curve of cognitive impairment. The slide shows the concentration curve. In the x-axis, it is showing the cumulative percentage of population ranked by economic status, and in y-axis is showing the cumulative percentage of cognitive impairment. So the concentration index value is showing that the minus value, minus 0.118, which quantifies this inequality. The negative value confirms that the cognitive impairment is concentrated among the economically disadvantaged, and the red line is showing the line of equality, and which shows that the gap between the observed curve, the concentration curve, and the equity is larger. So it's showing that the poor, they are much more vulnerable towards the cognitive impairment. The decomposition analysis I have done here. First one is showing that mainly the place of residence is playing a major role. It is showing 80% contribution towards the inequality of wealth inequality and cognitive impairment, as well as here you can see mainly the educational level, which is 31%, is showing the highest contribution towards the main inequality of cognitive impairment among all riders. And financial support is showing 12% of 12% of contribution, and living arrangement is also showing 0.6% of contribution to the inequality. So these are the major findings of my study. First one is the study observed that the prevalence of major cognitive impairment is higher among females than males, and it is concentrated among the elderly, those who are from lower economic background. Depression in old age significantly impairs the cognitive functioning among elderly, which is negatively affecting their mental acuity. And next one is the rural backgrounds estimates with a higher prevalence of cognitive impairment among them than the urban areas. And elderly individuals who have no education have a significantly higher prevalence rate of cognitive impairment rather than those who are attended school or higher education. So these are some limitations of my study. First one is that this is a cross-sectional study which limits us to draw any causal inferences from the findings, and in last dataset have relied on self-reported measures which may lack accuracy and potentially introduce some informational bias, and the exclusion of samples with missing information that may complete case analysis introduce potential bias. So adopting qualitative approaches may offer additional insights in future researches, and this is essential for a more comprehensive understanding of the observed associations in the study. In conclusion, I would like to conclude by saying that the study shows evidence that the elderly, those who are economically vulnerable, they are basically poor elderly, much more likely to develop cognitive impairment. They need much more attention, giving more focus on some specific groups, including elderly women, widowed elderly, and those who are illiterate, and among the individuals without any financial or social support. We have recommended here two strategies. First one is first strategy will promote the education coverage to introduce accumulated socio-economic gaps in old age. And second strategy I will be mentioning here, that is to improve the overall care of the elderly persons by developing healthcare programs and facilities by decentralizing the healthcare delivery system, and the community awareness also should be increased. Thank you. Thank you, Sunil.
Thank you, Madam Madhurima. You are just within the time. Nice presentation on cognitive impairment, socio-economic inequalities, and healthcare aspects. Thank you.
Thank you.
Thank you.